Well, welcome to our very exciting Echo session today. We're so excited to have you. Please introduce yourself in the chat. Who are you? Where do you come from? What do you do? Again, this Echo series has been the production of many folks who you will see on these slides, and we will call out in slides to come. Next slide. Our goal for today is to transform Minnesota healthcare systems to provide equitable, accessible, and trauma-informed pediatric to adult healthcare transition for all Minnesotans. We will give a special shout out to the Minnesota Department of Health, who is funding this project, as well as our partners from GOT Transition, the Echo Institute, and our core faculty and steering work group on the next slides. Here is our core faculty coming from across the country, including Debbie Harris, our lived experience expert, Maria Medina from mHealth Fairview, Wendy and Alyssa from the Minnesota Department of Health, Patience and Peggy from the GOT Transition National Alliance to Advance Adolescent Health, and myself and Rhonda from Gillette. Next slide. And our greater steering work group, representing a broad group of folks from across Minnesota who are interested in transforming the pediatric to adult healthcare transition. All of their bios are on the Gillette website for you to learn more. Next slide. This is for CME. You'll get all the instructions for CME in your email. Next slide. It's good for one contact hour. Next slide. In order to maximize our learning, you can help us by turning on your video, muting unless you're speaking. We love getting questions, so you can raise your hand. You can put a question in the chat. We monitor it. And of course, to introduce yourself when you are asking questions so we know who you are and where you come from. Next. We are doing our welcome. We'll learn a bit with a short didactic presentation, then we'll talk through a case and discuss together, and then wrap up for the day. We can skip this slide because this is our last Echo where we will have a case. For the case, we're not establishing any provider-patient relationships. Next slide. Most importantly, our Transition Summit is coming up June 13th. It is in St. Cloud, but we also have a virtual option. This will be our time to come together and spend the whole day really thinking about how do we transform this care. I'm excited because we're going to be bringing in people from out of state to really talk about how have they been able to be successful in doing healthcare transition across their organization. We'll be bringing folks from GOT Transition to talk about federal initiatives. Wendy will be talking about what's happening at the state level, learning from people that are actively implementing transition projects into their own clinics. So it's going to be a ton of fun. Please register, carpool. If you need a ride, let us know. We'll figure out a way to get you there. So with no further ado, I'm very excited to present today's session, which is partnering with special education and vocational rehabilitation for youth with IEPs and 504 plans. So we know that transition, the team that is built around a family that is helping a young person transition is vast. It's not just the healthcare community, it's the schools, it's the county, it's friends and family, and so many other pieces. So this is just taking a quick look at what are some of those resources that exist out there for you. I think on the next slide will be our presenters. So we have Heidi Haynes and Julie Smith, who are licensed school nurses from Robbinsdale and Bloomington Public Schools, really bringing their knowledge of being involved in this from the school nurse lens, and then also Cassie Campbell, coming to us from the Minnesota Department of Employment and Economic Development Vocational Rehab Services. So we are thrilled to have you, and I will turn over the mic to you.
The next slide. Hi, I'm just going to introduce myself. I'm Wendy Burkhorst, and I'm a part of the planning team. And the objectives we've identified for today are really identify ways healthcare can be included in special education transition planning, identify transition tools and resources for clinicians, youth and families, school nurses, and special educators on Minnesota's Disability Hub, and look at and identify innovative Minnesota cross-sector efforts to improve transition to adult healthcare, post-secondary education, employment, and independent living. As a person who really strongly believes in interagency collaboration and that it takes a team to working together, I was actually sort of one of my priorities was to be able to share with be one of the sessions here that giving an opportunity to learn more about the role of school nurses and how we can partner with them, and also with vocational rehab specialists, the deed workers. So I was pleased to recruit some of the people that I work with regularly. So next slide. And this is just really reiterating what Tori said and what I just commented on, that everyone plays a significant role in helping transition to adult health care. And it always, having had a foot in both the clinical and in the community, it's always hard to really understand or know exactly what is going on in the different agencies and different work. So at this point, I think next slide. I'm going to turn it over to Heidi. Thank you.
Hi, I am so thankful to be able to present today. And although it's hard to fit partnering with school nurses in 12 minutes, but I'm going to give it my very best. So thank you for giving me this opportunity. And it is daunting to represent school nurses, because licensed school nurses are really amazing and do a lot of fantastic work. And there's a lot of great ones out there that are really devoted to what they do. I've been an LSN for 17, well, I've been a licensed school nurse for over 17 years, but I've been working in transition for over 17 years. And I came to school nursing after getting my nurse practitioner certification and working in peds cardiology at the University of Minnesota. So I always had a heart for working with chronically ill children and their families, and did my master's thesis on family stress and chronic illness. So school nursing has been a really great fit, because I work at this cross point of so many different agencies like we just talked about. I thought I'd give a little basic on what a transition program is, because not everybody knows how the educational system works with students that are 18 to 22 years old. So services are based at a transition program on three things. They're independent living skills, vocational and employment, and post-secondary education. And to get in, a student in public education needs to have transition needs. And frankly, what 18 to 22-year-old doesn't have transition needs, Frank? And they do need to have an IEP. So they will graduate from transition based on their IEP goals. So they switch from a credit-based program to an IEP goal-based program. And so that is important to have a first IEP that's well written for transition goals. And next slide. I wanted to highlight that the NASN, which is the National Association of School Nurses, has this great quote about how essential school nurses are. And school health is often students, I'm adding to this, often students' most consistent healthcare right now. It is the one healthcare professional or health office that sees students 5 days a week. So not only are we going to be asking you some questions to get information to us, I want to emphasize to all of you outside of education that school nurses can be a great resource for you, because we do see students so often. Many tasks are done by a school nurse, and it's under our standards of practice assessment. We write individual healthcare plans. We do direct care, medications, treatments, implement other goals like the IEP goals. We delegate sometimes. Staffing is difficult in education as it is in healthcare. So we're not always the ones doing the direct care. Sometimes we are teaching and supervising and delegating direct care. We document, we do third-party billing. Next slide. And the specialization within school nursing is most of us work with special education students in addition. My role this year happens to be all of the preschool programming that's at another building. So all the birth to 5 programming, and I have a health assistant that sits in that office. And then I'm over here at the transition office, working with transition students, but I supervise and manage also the preschool programming. So many school nurses have to do all sorts of different things. But I wanted you to kind of see that school nurses on the IEP and special education team have a really unique perspective. And we are allowing students to thrive in an educational environment when we're given enough time and adequate staffing to be able to have a school health office that can operate with capacity. Change slides. I want to take this minute to sort of dive into the word transition, which is what we're all here for. And it always is change and transition is stressful and it's uncomfortable. And on a systems theory in the US, both healthcare and education are in a time of great change. And that's why I love this learning collaborative, because you're trying to increase communication in a time that's difficult. But know that licensed school nurses are at the intersection of 2 systems that are in the midst of change. So during COVID, of course, we became public health agents. It's just all been changing. And then we work in transition. We work with 14 to 22-year-olds, and specifically in transition programs, it's 18 to 22-year-olds. And they're going through immense change, physical, emotional, a lot of identity and sexual identity work is occurring. I have students that are, it's all that risk-taking behavior. So there's attempts to treat their own anxiety in different ways with chemical and substance. And then the great variety of students that are in a transition program, from the cognitively able, but students that have social anxiety or autism, and we're working with getting into post-secondary to wheelchair-bound, nonverbal, more severely multiply impaired, and intellectually students with intellectual disabilities. So it's this wide range of students all in one program. And we're talking to families for whom the end of school is on the horizon for them. And that's many have become very school dependent, even if it's been a fractured relationship. They know that that's where their child goes 5 days a week for 9 months of the year. And that is coming to an end at 22 for sure. So they're reassessing their own living situations with their student. Will they consider group homes? How independent can their student be? Their own vocations and what they'll do after school ends, during the day, and their own family roles. How much support will they need? What will they continue to do for their student? So change is huge. I always find my meetings go best with families. And when I introduce in IEP meetings, the fact that you can feel in the room, sometimes there's anxiety, there's grief that needs to be addressed before you move forward with some of the specific educational goals. But I want to always move families to excitement and possibility. And that's, I think, what we're all here for, is moving people out of anxiety, trying to get them supported and give them some excitement and possibility for their students, even though there's a big variety of services out there after school. I wanted to share an email. I'm going to quote from an email from a parent who has a severely multiply handicapped impaired student. And she wrote to me when I talked to her about this presentation, and she said, "Do you want the number of issues in the last 6 weeks I've tackled and maybe why it's so hard for parents? Here are the things I can think of just off the top of my head. I've looked at dental care, guardianship court requirements, Medicaid certification, county annual assessments, working on his new IEP, hiring and finding summer staff, signing up for summer programs, transition appointments for adult care. I'm finding and navigating that. That's exactly what you guys are talking about. Spring break, staff illnesses, day program applications, and coordination. And she said last week I clocked 68 hours of direct care for my student. And that doesn't include the coordination of care that I've just outlined above. Perhaps this perspective can be helpful for what you might think of in your presentation. So these are the students and families that we're working with. We all know that. Next slide. Next slide. Thanks. This is right from Got Transition, and I know there are Got Transition people here. We all agree that health is foundational, and it's very foundational for learning. But what I just commented on is I think relationship and trusting relationships is foundational for both health and learning. And working with that at first, I've learned that it always helps me help students go forward quicker when we establish that right off. So now we'll get in a little bit into the nitty gritty. Some of these slides, I'm assuming you'll get the slides afterwards. So if I don't hit on everything, but I wanted to show some of the perspectives of a school nurse and what they can bring to an IEP team. We aren't always included in teams that we should be on in education, partly because of short staffing. And we do provide such a unique perspective, looking at things like, I ask questions about self-advocacy and self-care. Can a student describe their own needs and the support and what they have? And the IEP is an annual review, and you can make a goal change. And so we talk about communication needs. Do they need either mobility aids, assistive technology? What is their organizational and executive functioning like? And I'm also always looking at the family's executive functioning. That differs a lot. And so how much support they'll need as they do all of this intra and interagency collaboration. I lean very heavily on my school social worker. We work together on the financial considerations, looking at health insurance, benefits, waivers. In Minnesota, we have Metro Mobility. It's a local medical transportation program. And so I'm able as a nurse practitioner and actually just as a licensed school nurse to fill out the health portion of those forms. And that helps families. They don't have to make an appointment with a healthcare provider. I can fill that out and help them get that application in. And of course, we're working heavily with vocational rehab and love it when they're able to attend all those meetings. Next slide. So this was just a little deep dive on one area. For instance, at an IEP, I might talk a lot about if the student knows their own daily medications, how they understand how to take them, when to take them, what to do if they don't work. So many times people just quit things that they don't think work rather than calling back to their clinic. I'm sure you see that a lot. And trying to get a dose change or working through it with their provider. And so encouraging all of those things. We can change slides. So to look at students holistically and think of them in their family systems, I wanted to just share some other topic that school nurses talk about. And I really want to, one of the topics that's not on here that probably would have been talking about chemical use and substance use and just seeing where students are at with that. And when a student is more intellectually disabled, of course, these are the topics that we're talking to their families about, how they're going to be supported in these areas. And the sexual health, healthy relationships, consent, online relationships get covered pretty heavily in my health office. And I just took this data from the Sexuality for All Abilities curriculum homepage, but people with intellectual disabilities are 7 times more likely to be sexually assaulted than those without. So it's a really critical topic for this time of life. The other one I should have added, we've lost three students have lost their parents this year, and we lost one former student. And so I'd like to develop more curriculum for students with intellectual disabilities and with needs on loss and death and on that is an adult skill. So that's another area that we're looking into adding for next year. You can change slides. Thank you. So Wendy helped me and we together facilitate a monthly meeting of Minnesota licensed school nurses who work in transition. And it's been so fun to connect across the whole state of Minnesota. Of course, we're all doing it in the middle of our school day. And so I'm hiding in the social worker's office, but otherwise we have school nurses coming in and out of that monthly meeting. But when I talked to them about what I was going to be able to talk to you about, these are the things we need from clinics and from organizations outside of our own. We're always chasing releases of information, and it would be wonderful if garnering those for school health would be done on both sides. So these are the questions I'd love asked at meetings. Would you like to sign a release so we can communicate with your school nurse? Do you need orders written for medications or treatments that'll occur during the school day? And I would love it if providers would write very specific orders thinking about school health with parameters, because sometimes we're delegating to unlicensed professionals. I also would love it if you have students who have chronic and complicated needs that you would list if their parents can alter their doses or treatments, because I always want to stay legal. I want to stay within the law, but I also want to develop relationships with families. And it helps very much if a mother calls and says, stop the guanfacine for now. We're finding he's this way in the afternoons. And I have an order for guanfacine. It's hard to know what to do, but in transition, I count on relationships, but it would be very helpful if physicians thought of those things and worked with families so that the school day goes well. And then I absolutely love now the ability to get pretty quick visit summaries. And with my portal and my health sort of things, parents can share them too. But if students would come to me the next day after an appointment with a copy of their visit summary, it would give me a lot of information for how I care for them, but also how I educate them about their health. So I can actually be the second person to say some of the things you've already said in your appointments. Next slide. These are just a few of the tools. There are so many in both our disability hub, .mn, the youth and transition toolkit. I got to add some health content to this past summer. Got Transition has so many examples that you can pull from to use. And then the person who is presenting our case study is Julie Smith from Bloomington, and she wrote this slideshow health teaching example for some of her more cognitively able students about how to manage their own health. And she graciously said I could share it, and I'm going to take it for my own and alter it a little bit and use it. So just an example of what school nurses can do for teaching as well. Thank you. Moving on to Voc Rehab. Unless there are questions, or we can take them afterwards.
There was one quick question, Heidi, of does the school nurse need a separate ROI if one for the school already is in place?
Yes, we would like a separate. Sometimes it's to school health. And so it doesn't have to necessarily be to a specific person. But yes.
Sounds great. Thank you.
All right. Hi, everybody. My name is Cassie Campbell, and I work with Need Vocational Rehabilitation Services. And today I'm going to be explaining Vocational Rehabilitation Services, otherwise known as VRS, and the student career services we provide. I just wanted to note, while this is focused on Minnesota VRS, I noticed that there were quite a few attendees from other states as well, and to note that each state does have their own VR office and program, and will offer very similar services to what we offer here in Minnesota. So if you have any questions, like, you would always be able to access your own state's VR program as well. Next slide. So VRS is a state employment services agency that serves people with disabilities. We are a division of the Minnesota Department of Employment and Economic Development, or DEED. We also have a sister agency called State Services for the Blind that provides the same services for people who are blind, low vision, or deafblind. If you need help referring a student to them, you can always just let me know. VRS is a partner in the Career Force system, which is the state's public workforce development system that has resources available to any person looking for a job or any employer looking to fill their workforce needs. There are 50 Career Force locations in the state, with the nearest one to you being able to be found online at our Career Force systems website. Lastly, keep in mind that VRS serves both youth and adults. We can provide services to individuals with disabilities as young as age 14 all the way through retirement age. That is important to know because some students may not choose to apply for services while they are a student, but we want them to know that they can certainly apply later if they ever change their mind and they would like to get into the workforce. Next slide, please. VRS can serve a broad range of students. We assist students who have individualized education programs, or IEPs, and we can help students who have a 504 plan. We can also serve students that may not have a formalized plan with the school, but otherwise have medical or mental health impairments that are documented by a doctor. Next slide. It is important to keep in mind that VRS aims to join a student support team so that we can all work together to provide seamless services and supports. We want to ensure that the youth is aided in driving their own plans along with the help of their family, school staff, vocational rehabilitation staff, and any service provider that may be assisting the student, and waiver or county case managers. Next slide. Here is a high-level overview of the primary services that VRS provides. At the heart of all we do is forming a working relationship with the students we serve through career counseling. Through counseling, we identify the other services they need, which can include job training, help in finding a job, services to help keep a job, pre-employment transition services, and much more based on a person's needs. Next slide, please. Pre-employment transition services, or PREETs, are the primary services we offer to students while they are in high school. The 5 PREET services are as follows. We have job exploration counseling, which is about helping students understand their strengths and interests and learn more about careers related to those. We have work-based learning experiences, which allow students to get into the community to see and try work. Post-secondary education counseling assists students to explore training and education options related to careers they are interested in. Workplace readiness training teaches basic skills that help students be successful on the job. That can include things like how to apply for jobs, how to access transportation options, how public benefits might be impacted by working, or independent living skills. And then finally, we have instruction in self-advocacy, which teaches students about their rights and how to tell others what they need related to their disability. Next slide. Linked on this slide is a nice resource that also helps define the 5 PREET services and everything that can be included within those services. It's a very broad range that we can offer and provide to students as they're looking to get into the world of work. Next slide. So it's important for you to know that VRS is required to provide PREETs in collaboration with every high school, and that we have PREETs available statewide to all students who are between the ages of 14 and 22. Next slide. We also have 2 staff assigned to every school, a VR counselor who serves students through our full VR program, and a PREETs representative who serves students through our introductory career services. You might not be sure who to refer a student to, but that is okay. You can refer any student to either of these staff and they will help you figure that out. That is why we say there is no wrong door for referrals. We also have linked on this page a directory of all the high schools in the state in case you need to figure out which VRS staff serves a particular school. Next slide, please. Here is the process for students to access VRS. The first step would be to contact one of the VR staff assigned to the school they attend. VR staff will then set up a meeting with the student and ideally their parents or guardians to explain services, how to qualify for services, and provide an application packet. Once they receive the completed application packet, the VRS staff verifies whether the student is eligible for services. Again, this process includes obtaining verification or documentation of the student's disability. If a student is eligible for services, then planning for the services the student needs will begin. Next slide, please. Planning for services ideally begins with a team meeting with the student, parents or guardians, and school staff that know the student best. That meeting would be to discuss the student's pre-EDS needs and what services VRS will provide, how VRS services will be coordinated with school services, how and when VRS will be provided, how communication will take place and keep everyone updated on the student's progress, and when follow-up meetings will take place with the team. Next slide, please. Note that VRS contracts with community partners that may join a student's team to help provide these services. These partners include community rehabilitation programs, or CRPs, which are community-based organizations that are experts in providing employment services to persons with disabilities. Centers for Independent Living, or CILs, are programs that are operated by individuals with disabilities that support community living and independence. And CareerForce includes other employment agencies that are available to the public. Next slide, please. We do have linked here a 3-minute video and a flyer that will explain our student career services if you are needing to access or have more questions after. Next slide. And then finally, adults no longer in school can also access VR services by contacting the office closest to where they live. There is a link on this slide to a web page where you can enter a zip code and find the nearest VRS office. And we also have an online interest form that they can now complete. That would also link them to an office and have somebody reach out to them. And next slide, please. And that would be what we have for VR services. If there were any questions about how to work with us or for any students that you might work with.
Hi, thank you for your presentation. I have a question. I'm Bonnie Carlson Green. I'm a neuropsychologist at Children's in St. Paul. And one of the frustrating things that I encounter is when I try to refer younger students, 14, 15, the feedback I get from parents is that the school has said, no, we'll deal with that when he's a senior. How do I help families advocate to get their students connected earlier so that a relationship can be built over time?
So referrals for VRS do not have to come from the school. They can also come from you directly. It can come from the parents directly. If you know what school that they're attending, you can always access on that one slide where I had the find the VR office closest to you. We have a student page as well where they can find the school staff that services them. Okay. And the family can contact them directly. They don't have to go through the school.
Okay. I had been doing that, but I didn't know, like, I want to try to get the school involved as well. In that.
Yes. So once the student is enrolled in VRS will get they'll coordinate with the school so that the school isn't left behind.
Okay,
so
great. Thank you very much.
Yeah.
Any other questions for either Heidi or Cassie? Cassie, one of the things I think about, when I was a resident, I took care of a 19-year-old who had lupus and had pretty severe lupus, had lots of admissions and complications come up. And one time we were sitting in the office and I asked her, like, what's your plan for the future? Like, what do you think? You're gonna go to college? Do you want a certain job, etc.? And she had said, I've never thought about it. I've always been so consumed by the last time I was in the hospital, the next time I was in the hospital. And this patient didn't have any intellectual disabilities or things. Is vocational rehab something that could play in that situation as well? And it was certainly not built into her schooling, because from the school standpoint, like intellectually, she didn't need the vocational rehab, but she had missed all of the opportunities of like dreaming and thinking about her future.
Yeah, so vocational rehabilitation services isn't only for students with cognitive disabilities. We recognize that disability is a broad range, from people that maybe have depression and anxiety that can impact their work, but they wouldn't have any cognitive disabilities as well. So for that point, she does have a disability or a medical condition that's impacting her work and ability to go to work, dream about work, and understanding her rights and accommodations that she'd be entitled to when she goes to work. So that would definitely be a case where vocational rehabilitation would have been a service that would have assisted her, because we service anybody that, when we think about it, it's anybody that has an impairment that would impact work.
So in the chat there, Audrey has a question around kind of the same thing. But for individuals with physical disabilities or differences, amputees, etc., how does Voc Rehab get involved in that?
Yeah,
What sort
so
of resources are there?
Again, VRS just has to document an impairment that impacts work. So we have 7 categories that an individual can qualify under, from mobility, self-direction, personal care, interpersonal skills, work skills, communication, and there's one more that I'm blanking on off the top of my head. So as long as they hit an impairment in any one of those categories, and I think it's honestly any disability now, so they don't even need one. We in Minnesota do not currently have a wait list or order of selection. We are currently open to all categories. So anybody with a disability would be eligible for vocational rehabilitation services in Minnesota.
Excellent. All righty. So next, I think we'll move on to our case. And I think Peggy is going to be leading our case discussion. Thank you.
Thank you. I'm excited to hear about the Lisette, and I'm wondering if Julie will present her case.
Sure. Hello, everyone. So I will just kind of read through here, but this is our case example is a woman named Lisette. She's 20 years old. Her disabilities she's fairly complex. She's got static encephalopathy with an intellectual disability. She also has type 1 diabetes. She has physical difficulties and so uses a wheelchair but can do short distances with a walker. But so mobility and communication are challenging for her. Her strengths include that she is, her functional skills are strong. She's ready and has a good support network for independent living. She has close friends at school, gets along with others, enjoys socializing. She wants to get married and have children. In a few years, she wants to move out into her own apartment, and she'd like to get a job, wants to be in fashion design. So I think you can move to the next slide. As far as needs, there are quite a few. Mobility, as I said, and communication are challenging for her. She does have PCA care that her sister is currently providing. She needs a new wheelchair, and she will also, when she's able to find housing, have need it to be accessible for her. She needs some help with safe socialization. She is very outgoing, but is vulnerable. And then strategies for independent living, for preparing for school and work each day. She needs support with telling time and reading comprehension. And then just understanding overall systems for the family. She's newly immigrated from Liberia. So this is our Lizette, and would just love your thoughts on ways to support her.
Thank you so much, Julie. I
Mhm.
loved your discussion of the strengths and needs. I want to ask the group if you have any clarifying questions about Lisette, and then we'll go into kind of an open discussion about Julie's question. Well, it sounds like you made an excellent case, and so we'll turn to your question, Julie. If you could repeat it once more.
Sure. Just what are what do you see are ways that that we can support her? The systems that need to be in place for her.
As we begin to think about that for Julie and Lisette, I want to keep the theme of this conversation about elevating health in this discussion area. So let's open it up to the crowd to see ideas for Lisette and Julie.
I would imagine that understanding the healthcare systems and learning about them, if you've come from Liberia, so you might not even know that there are some systems of support that could be garnered. So I would say that would be a first clinic or school social worker that starts on that. And
I would say that she needs some functional skills, some readiness skills for independent living, and maybe getting that through the school, depending on the level she's at, having that as goals set on her IEP, and then also having some mobility issues I'm from a different state, so I don't know if you have mobility where your public transportation could come right to your door and pick her up and take her where she needs to go. And communication might be challenging, it says, so maybe having some kind of augmentative device to help her as well. So also, she has friends, see if they can help her. And also I know here we have with the ARC, we have different social clubs that you can be involved with that, you meet great people and you can make more friends, and some drive and some don't. So you have maybe a backup driver for yourself. So, those kinds of things.
These are great suggestions. Other thoughts? I was wondering a question, Julie, given that Lisette is 20 years old, to learn whether or not she's got a primary care provider, and if it's a pediatric provider, will she have to leave that pediatric site? Oftentimes those from other countries stay in a clinic and they're served by a provider who cares for both children and adults. The other thing is whether or not she has insurance and whether or not she's applied for SSI. Again, all these help to ensure independence going forward. Other comments?
I'd be interested in knowing, does the school help with any of like the SSI pieces or helping identify that? Or are we expecting that happens in the medical system?
No, well, in Florida, it does not happen with the school system, and it doesn't help to happen in the medical system either. It happens with you finding someone that knows about it. I'm a SOAR processor, so I can help families, or I can help older youth or younger youth fill out the paperwork to do it. So we have people like that in different agencies around town that can help you if you're connected to an agency. Even if you are a member of the ARC, there's people in the ARC that can help you do those paperwork. Also, they can help you do guardianships, power of attorney, and all kinds of things. So you just, if you're with an agency, a lot of times they have those people that are trained in those areas, but also work there as maybe a caseworker, but also do that as well.
Jill's point about this affiliation with, in her case, the ARC or other community-based organizations, I don't think can be understated here. They are, they have the keys oftentimes to unlock the doors that seem very locked on from a family's perspective.
Right.
I will say our school social worker does help with yes. So school social workers and nurses do help with getting students set up with some of the insurances, more the social worker, but we start with the questions and
I think that's fantastic because we don't down here. So I think that's amazing. That's great.
But building that documentation is so very important, and whether or not it's through a medical summary or an IEP or an individualized plan for employment, these are all really important for her.
So one thing that stuck out to me with this case is we've got a young woman with type 1 diabetes and communication challenges. And so how does she communicate if she's having issue, if she shows up in urgent care, the emergency department? Are there action plans or whatnot in place for that?
That's a great point. And I would say during transition time 18 to 22, we frequently have students come in with somewhat unrealistic ideas. Like I'm not sure independent living is probably in her near future. And so how independent can she live, and helping her see and be able to advocate for herself in that way, to think of safety. And know that she wouldn't be comfortable with one of her dreams yet. And so it's kind of, it's both a psychological, emotional, and it's a practical question for her. And it's bringing up those issues that help students think of it themselves too. They come in with some dreams sometimes that may have to be altered a little bit.
And with type 1 diabetics, one of the things that I do when working with students, any of the students with their healthcare is do you have a medical ID bracelet? So that's, if you were to collapse somewhere, that a passerby, a Good Samaritan, would know in some way how to help you. How are you carrying your medications? Who has access possibly to, and if you're wearing a Dexcom, who can do the readings? And sometimes when kids are able to move into like a group home situation or whatever, they would have, possibly have somebody there also following them, or family members. So there are just, you're right, so many aspects, and the education about, whether or not you even recognize what's going on with your body and what you're feeling when you're having, a high or a low blood sugar. So yeah.
Lori?
Heidi, did you say during your talk that school nurses are not automatically included in IEP planning?
That is true. Julie's nodding as well. We have staffing issues are hard, and we are around, we are in an education system that doesn't always understand fully what we do. And our staffing is put together by administrators that don't always understand the needs of the students and what we can provide. And so we often aren't given enough time to practice in the way that we could and want to. And so we're always prioritizing emergencies first and then moving down. So this kind of advocacy, when we're allowed to do it, is amazing. I have a diabetic student who is just he was just diagnosed as a 16-year-old. His mom has lupus, and they struggle, and he's cognitively pretty low. And he came to me without knowing how to give himself an injection. And so we've been taking baby steps, and now he's got a Dexicom, and I've taught, he can't tell what, like if he's got a 164, he can't point to me on the correction scale if that's between 150 and 199. And so now I'm working with him with color. So I just keep working back to what he's able to do. And on his continuous glucose monitor reading, there's red, yellow, and green. And so I'm trying to help him stay in a color rather than using numbers. And so it's all of that kind of work that if I wasn't given a little bit of time, this family, when he was at high school, the last 2 years, he never brought insulin to school. He was not treated while in school. His mom just, that did not happen. So this is the first time he's gotten a little bit of insulin during the day.
These are wonderful examples of what school nursing is all about. I see Jill's hand, and then I'll turn it to Tori.
I think transitioning for me, I have a daughter that has mental health disorders, and she's in college, and I have a son who's turning 28 next week, who's on the autism spectrum. But for me, transitioning started when I got the diagnosis at 2.5, 3 years old. So I always tell parents whenever they're first diagnosed, transitioning starts now, because you have to really start thinking now what your child is going to be down the road and what your life is going to be down the road. So you need to start teaching them now how to make their bed, how to clean their room, how to cook, how to cook food for themselves. I mean, my son knew all of that by the age of 18. So when he turned 18, he actually moved out. He was still going to high school, but he moved out, and he moved to the Arc Villages, which are like little houses that were apartments. And he lived there for 2 years, and then he moved because he needed so little care that he moved into his own apartment, and that's where he lives now, in his own apartment. But I mean, it was because we started when he was very young to teach him all of those skills and not baby him. You know, of course, we do still baby him a little, and give in to him a little. You know, that's what mom and dads do. But you know, we did start that transition very early on, because for him, it took 1,000 times to teach him how to turn on the washing machine for him to get it. And so, you know, now he has no trouble with it. But it just, for us, that's what we believe. I truly believe. You know, so it was really important for me to start that young. And I think that's really important for any child, whether they have a disability or not, but especially for our kids that have a disability of some kind.
You're here.
Sorry.
It's so great. Yeah. It's a privilege to meet every family where they're at. And just try to help them, you know, even understand some families are just, like you said, to the point where they're still doing everything for their child. And as Heidi alluded to, there can be a big grief process when those services are removed from school. So great work.
I'll turn it to Tori. Thank you.
Well, and I also wanted to have my own life after, you know, when he grew up. So, I mean, I got rid of his dad, so now I need to get rid of him.
Excellent. Well, thank you so much, Heidi, Julie, Cassie, for this very enlightening conversation. I think when I think about my own practice, school is kind of this like black box of like, I know I'm writing orders. I take with me the idea of like giving parents some discretion of orders around both medications, but also what comes up a lot for me is feeds, and giving some little flexibility in my feeding orders for young people who are going to school. And the other thing I think about is really including that nurse in my conversations about, do the parents know that there's a school nurse, who it is, have they built relationships? And then I think in the age of patient portal messaging, and again, just reiterating that you have this portal that you can use, and part of the power is that now you can easily send the results back and forth as you're comfortable. I think one of the things that I've also learned over the years is how to include school nurses and also parents, and making sure that we're not just, if I get a school contact and we have all the ROIs signed and things, all of a sudden, sometimes decisions can get made without the parent being directly involved, in how important it is to just make sure that this ease of communication doesn't exclude families in the decision-making as well. So I'm thrilled to learn that there are so many passionate school nurses out there who want to help patients thrive, and young people thrive and transition well into adulthood. So very excited to work with your group in years to come. But with no further ado, this was our last kind of formal ECHO session. Our next step is on June 13th, that transition summit, and I'm sure we will throw the link back in the chat, and I think maybe even up on the screen if we have a QR code up there. So please register. We'd love to have you for part of the day, all of the day, in person, virtual. We are recording it. We will figure out how to get those recordings out to folks that are interested in that. But again, that is June 13th. Then, because we think it's so important to hear and learn about things and hopefully leave with some action steps, we're following it up with a session on June 17th together as a group to kind of talk about how do I take this energy that I had so much about, right? I took a whole day to learn. How do I put that into my practice, into my day-to-day life? How does it actually become a real work? So there's the QR code for the summit. And with no further ado, I think the next slide will have the QR code for the survey. And you'll also get that in your inbox. We appreciate any input, insights you have. And we are working closely with the Minnesota Department of Health to figure out how can we continue this work of making transition in Minnesota better, safer, more equitable. We are just so thrilled to have you all here today. Thank you so much.